It's time to talk health matters on Channels Television. Glad you could join us on the program. I'm Jomi Otaigbe. The COVID-19 pandemic continues to test the resilience of health systems around the world. The global number of confirmed cases as of July 18, 2020 is 14,109,173, with over 7.8 million recoveries and 602,711 deaths recorded. Nigeria accounts for over 35,000 of the confirmed global figures. That's at 14,633 patients discharged and 772 confirmed fatalities as of July 17th. As the world continues to learn more about this viral disease, today on Health Matters, we'll be looking at what differences and perhaps similarities that exist between COVID-19 and malaria infection. Let me give you a bit of background into the global figures of malaria. As of 2018, an estimated 228 million cases of malaria were recorded worldwide, out of which 405,000 malaria-related deaths occurred. To take us through what we need to know about COVID-19 and malaria and why we need to take both infections seriously, I'm now being joined from our Abuja studios by the Head of Risk Communication Division at the Nigeria Center for Disease Control, NCDC, Dr. Yaya Disu. Doctor, good to see you.
Good afternoon, Yomi. Thank you for having me.
Thank you for coming. So scientists and public health physicians like you have told us that COVID-19 is a viral disease and malaria is a disease that is caused by parasites. What significant difference or similarities, do exist between these two diseases?
I would like to start with you already said malaria is caused by parasites, while COVID-19 is caused by virus. From our basic understanding of biology, we know classification of organisms by either their bacteria, virus, or parasites, and so on. And then the similarities between them is when you look at the presentation for the two diseases, they are similar to some extent. Because both of them have fever in common and they have headache. Sometimes body ache is common to both of them, as well as sometimes in malaria, you may have a sore throat, which could also occur in COVID-19. But the issue of general weakness is also common to both of them. And then, sometimes when you have malaria, you also have other infections, maybe superimposed bacterial infection. And these may make you to have things like cough, sometimes you have diarrhea, which could also occur in COVID-19. COVID-19 is mainly a respiratory illness. So it presents mainly with fever, cough, and then breathing difficulty. So that is why there may be some confusion between the two diseases.
When these, for instance, malaria would present, in terms of the development of the symptoms, how long does it take for it to present with symptoms, and how long does it take for COVID to do so?
For average incubation period of malaria is about 15 days, which means the time the parasite is introduced into the system, and then when you count it onward till the time the person starts showing symptoms, is average of 15 days. It could be less than that, and it could be greater than that. It also depends on the species of malaria that one is having. And then for COVID-19, the incubation period is 2 to 14 days. On the average, most people, by our data, come down within 5 days, 5 to 6 days.
Let's go back a bit to some of the symptoms that you mentioned. You've mentioned fever, malaria, of course, will also present with fever, and COVID-19. But for COVID-19, we have also heard of loss of taste or smell. I'm not sure malaria has got that part of it, maybe in terms of smell. But some people will say when they have malaria, they also, perhaps lose their taste bud.
And those are recent discoveries about the symptoms that COVID-19 presents with. And then in most cases is cough, fever, difficulty in breathing. But recently, we are now having many people who are coming down with loss of smell, loss of taste, and which you don't see in malaria. So I think because you asked this, I've also had experience where people who are even close to me, who have told me when I have conversation with them, and that they have experienced this in recent times, and the people around them, even in their places of work, and they have also experienced the loss of taste and smell. I said, oh, this is classical, this is COVID. And they may have mild or no symptoms at all. It may just be the only thing they present with. So they should go for testing. And so it's important that we also continue to create awareness about symptoms of COVID-19 and how one can also distinguish it from malaria. But the ultimate way to confirm is by diagnosis, by laboratory testing. For COVID-19, it's by the polymerase chain reaction that we do in Nigeria. The samples have to be collected and be tested in the lab. For malaria, it has to be through our microscopy or the use of RDT to confirm malaria. So that is why healthcare workers have significant roles to play in these regards. And we don't encourage self-medication.
Talking about health workers, if someone comes to the hospital and presenting with some of these symptoms that you've mentioned, the ones that malaria has got, and of course COVID-19, what should the health worker do?
And then the index of suspicion of healthcare workers should be very high. That is why we continue to conduct training for healthcare workers across the country, both in public and private facilities and at all levels of care. And they should know well about, know enough about this COVID-19, as we also get new information and they are also updated, because information about COVID-19 is rapidly evolving. And that is why our measures keep changing. So the healthcare workers also need to know about this, because they are in the front line. They are the ones that first see these people. Patients generally, unless somebody who already understands that he has contact with the COVID-19, that is why the person might suspect he may be having COVID-19. But because we're already in the phase of community transmission, where you can hardly trace the source of the infection, because it's almost everywhere. And then you have a large number of people who are asymptomatic, who may be carrying this disease that they don't know. Be carrying the virus. So such people will come to the hospital with other complaints. It may just be for hypertension or diabetes, or even they may just tell you that they have flu or they want to treat themselves for malaria. That's why they're coming to the hospital. So that's why it's important for the healthcare workers to have high index of suspicion, and then to be able to take appropriate measures to protect himself, protect other healthcare workers, protect other patients that are coming to the hospital. So, and then again, for them to be able to collect the right samples for diagnosis and then refer appropriately based on their suspicion.
Talking about suspicion, yes, it's good for the health workers to have the high index of suspicion, but what happens in some of the cases that we have heard that, people who, of course, some people are afraid to go to the hospital because they feel that they could contract the virus in hospital settings. But there are other cases that we have heard where patients with symptoms that looks like that of COVID-19 are, turned back. How do we, bring this together and ensure that those who need to get care should get them without, fear of being rejected?
The important thing about this is our understanding of this disease, of the virus and how its characteristics, and then how it is transmitted from one person to another, and the protective measures that we need to put in place. And it's not only the healthcare workers that need to know this, also the members of the community. And then, so what this means is when you suspect this may be COVID-19, either because you are in a community where you have a lot of confirmed cases or you are close to people who have been confirmed, then you call the number designated for reporting COVID-19. All states have their numbers, and then it is when you call these numbers, they are not going, we encourage you that you should call the hotlines for Nigeria Center for Disease Control. And then for the healthcare workers too, before people, peradventure, when people come to the hospital, and because many of them are asymptomatic, our data has shown that close to over 60%, around 64-65% of people are asymptomatic, and if they come, they don't even show symptoms at all. And generally, you have over 80% of people who show no to mild symptoms of the disease, and so which means anybody can come with COVID-19. But peradventure, the healthcare workers suspect, and it is when we don't have adequate knowledge of what to do, or we think we don't have what it takes to protect ourselves, that is where fear results. And the situation where you have high anxiety, but lack of confidence. And that is what results in denial or stigma. If it is external for the person who is responding to the patient, the person will be afraid, and then he wants to run away, and then that is a kind of it results in avoidance behavior. And then if it is the patient themselves, and then because of fear of what may happen, COVID-19, or people rejecting them, so they might go into denial because they don't know what to do, and then they might now result into other things that could be risky, and that can further increase transmission of the disease in the community. They could go underground because they are denying, and they won't own up for people to be able to help them, or for the healthcare workers to come in to quickly, take them to isolation center, collect their samples, and as well, and then also do health education, do contact tracing for people around there, and that is the best way we can control this disease. So enough knowledge, understanding, perception, they are very key when it comes to how we respond to this disease at every level. And this is the reason why everybody has to take responsibility for understanding this, seeking information from the right sources. We understand that there is a lot of misconception out there. Even misinformation is complicating things. And that makes people to lose even confidence in the healthcare system. And then as well as doing things that will not really help us, but worsen the situation for us. Like people will tell you that they want to go and take garlic, they want to take all manners of things, and then they want to go to a traditional person who could treat them.
Okay,
so,
maybe,
I think
Doctor, just hold your thoughts on that. We'll still be talking about some of the misinformation when we come back from this break. But of course, you tell us if it's possible for an individual to have both COVID-19 and malaria at the same time. And it will also be time for you to join us in this conversation. That's talking about the viewers. You can join us on 0805-468-3514 or via Twitter at yourme_or Stay with us. Welcome back. You're on to Health Matters on Channels Television. Remember, you can join us in this discussion by calling 0805-468-3514 or send a tweet to yourme_o. So, Dr. Disu, let's talk about this. Can someone who is dealing with COVID-19, has been identified or confirmed to have COVID-19, also at the same time have malaria?
Yes, it is very possible. You know, we're in malaria endemic environment where many people may even be carrying malaria parasites without them knowing. And when some situation occurs where the immunity comes down a little bit, or as a result of stress, that's when they come down with these manifestations. Because we have mosquitoes around us that carry this parasite that bites people, and then so as a result, different studies have shown high prevalence of malaria parasites in people, and there's one that even says about 60% of Nigerians carry malaria parasite in them. There is another one performed in Kano that also showed that about 48 to 54%, based on different age groups, are positive for malaria parasites. So under that background, on that background, then when somebody has COVID-19, the person might not even be showing the symptoms before he contracts COVID-19. And so when COVID-19 manifests, when you get to the hospital, and they are likely going to conduct the 2 tests to check whether you have other underlying conditions so that they know what to manage. And then as a result, you may diagnose the 2, malaria and COVID-19, in the same patients. Sometimes it may just be COVID-19 alone they will diagnose in that person, but it is very, very possible because we are in malaria endemic environment.
Same time. So we have God's Power joining us from Magodo. I think he has a question or a comment to contribute on the program. Huh? Hello.
Okay, good afternoon, viewers.
Thank you for joining us.
I'm calling from Magodo.
Go ahead, please.
Okay, what I want to say is that my own little contribution is this. I think the advocacy from NCDC and even Lagos State government should still be heightened, because a lot of people actually, they've caught the virus, they are not aware, because the symptoms actually look as if it's malaria or common cold or even body pain. So I think if this information is well passed across to the community through maybe the ballets or the leaders in the community, for people to be aware, to make themselves available for this test, because a lot of people, as I observe, they are asymptomatic. So if they are asymptomatic, you actually don't know whether you have the virus. So with this, people that have comorbidities that we are actually scared of might fall victim. So because people that have their immune system very strong, they might be good with it. But those percentage of the guys that have comorbidity that we're actually scared of, the elderly, might be victims. So I feel a lot of advocacy should be done, especially at the community level, maybe via our local parlance or our local language, or even the town criers, for people to be aware that it is real and how we can actually help ourselves to prevent people that are actually maybe having comorbidity or elderly targeted, and to help them to live after this coronavirus. Thank you.
Power. Dr. Disu, I think earlier before we went on that break, you were talking about information and, of course, misinformation. He has mentioned, something that is very key here. Getting the message down to the people at the grassroots level. How much of this do you think we still need to do?
A lot has been done already, but we don't have to stop. We need to continue doing it. People are getting tired of COVID-19, but COVID-19 itself is not getting tired of people. And new information we discover every day, and that's why we need to continue to communicate this to people, especially at this stage of the outbreak where we have community transmission. The best way to tackle community transmission is to use community approach. Which means everybody in the community has a role to play. And that is why government has adopted whole of society approach for combating this pandemic in Nigeria. Everybody has to take responsibility at individual level, at community level, at family level, at policy making level, private sector, the public sector. Everybody has a role to play. Private organizations, societies, and then we all have roles to play, including the media, just like what you are doing now. And then we don't all have to wait for government to conduct this exercise of informing the public, and wherever you are, one-on-one, the person you know, your neighbor, you can also communicate this. But there are mechanisms that have been in place for getting information down to the public.
Okay.
And we've gone beyond just communicating just facts about the disease, but we are also talking about, based on the data that we get from the field, media scanning.
We'll talk a bit more about the data. Let's be joined by Damilola. Damilola, thank you for being on the show.
Okay, good afternoon.
Go ahead, please.
Okay, good afternoon. Well done for all you do. Nice program every week. Okay, quick one. Please, I want to ask about the surgical mask. So now, the surgical mask and the cloth mask. Can the doctor actually shed more light, about this? Because the kind of environment of, especially when you go to the offices, and when you get to the office, and we have some people using the cloth mask, and we have some people using the surgical mask, and because there are some offices that they are still not practicing the social distancing properly. And, so I always wonder, is it better for one to really if you can afford it, should you invest in actually buying the surgical mask or the cloth mask? Because I know that the surgical mask and social distancing is very key in order to be, in case you are asymptomatic or not. So can the doctor just shed more light between using surgical mask and the cloth mask? Thank you.
Right, thank you, Damilola. Dr. Disu.
Okay, thank you for that question, and that's an interesting one. And one key thing we need to understand here is the principles. When we understand how this infection is transmitted, then we know what we are doing, why we are doing what we are doing. And then if you look at the data that suggested we have a large number of people who carry the virus who may be transmitting it without even showing symptoms, which means your next door neighbor, even your own child or your own daughter or your own husband may be carrying the virus in the house without you knowing. And what we now try to do is we're trying to stop transmission from source to reduce the risk. When everybody uses masks, that is the only time the mask is protective. When everybody uses it, so those who carry the virus, who are likely to shed it when they are talking or when they are laughing or when they are sneezing, then the mask serves as a barrier to prevent it from escaping into the environment. It is when everybody uses it, that is when the transmission can be reduced. But the difference between surgical mask and cloth mask, surgical mask is more effective, but that is better used in hospital environment where you have congregation of people who are ill, who are likely to carry this virus, and where you are likely to have high exchange of this virus in the environment. And then again, considering global shortage of resources, and we have to optimize the use of our resources. We want to encourage only healthcare workers to use the surgical mask because they are the ones that really face the risk, and then they need to really protect themselves. Cloth mask is good for environment where you are not providing healthcare, but where everybody uses it, we limit the transmission, the ejection of droplets that can carry the virus into the environment. Whether public space or outside the healthcare sector. So I think that's what I would like you to know. You need to know the principle behind use of cloth mask, and where we say everybody should use cloth mask. And then before now, we used to say healthcare workers alone should use a mask. But with community transmission and the knowledge of asymptomatic transmission, then that means that then we all have to use this cloth and this mask. In addition to this, we should not forget that physical distancing is also necessary, and then frequent hand hygiene, because peradventure somebody does not use the mask well, like you see now, a lot of people are not even wearing the mask.
Yes, I know that this is a discussion that is going to go on and on and on, because we still continue to, create this awareness. Thank you so much, Dr. Disu Yaya, for your time on the show, the head of risk communication at the Nigeria Center for Disease Control. Thank you for joining us.
Thank you.
So as we wind down health matters, remember that if you or anyone around you, experiencing some of the symptoms that we mentioned, don't hesitate to call the hotlines, the Lagos State COVID-19 hotlines, and of course the NCDC hotlines. And if you miss any part of this show, do log on to channelstv.com/podcast for the audio and video versions. Thank you so much for sharing your time with us today. I am Yomi Otaibe.